In this video, we'll be exploring the surface anatomy and ultrasound images of the femoral triangle and also the anterior and medial thigh. To begin with, we're going to look at the surface anatomy of the anterior thigh, and we'll also look at the knee. So with our patient here seated on the end of the bed, if we ask them to just raise the knee off the end of the bed, we'll emphasise the rectus femoris muscle. And you might want to try this on yourself at home and feel how it becomes more easily defined in this position. The reason it does this is because the rectus femoris is crossing the hip, and you can relax. It starts at the asis and joins at the top of the knee. Now if we look at the knee, I just want to highlight a few areas that you can palpate on yourself. So to begin with, just above the knee, we have the quadriceps tendon connecting to the patella. We then move on to have the patella itself, which then moves into the patellar tendon or patellar ligament, remembering that it connects from patella to the tibial tuberosity. Either side of this joint space, you can feel the infra-patella fat pads. To place a greater emphasis on the muscles of the anterior thigh, we can ask our patient to step forward into a gentle lunge position. Above the knee, you can note the bulge of the vastus lateralis and vastus medialis muscles, with the rectus femoris running through the middle, connecting to the top of the patella. It is possible to measure lower limb length, and we can do this to look for a leg length discrepancy. We would take a tape measure and measure it from the asis at the hip all the way down to the lateral malleolus at the ankle. That would be called true leg length. We can also measure the thigh length, and we go from the asis down to the distal edge of the lateral femoral condyle. A discrepancy of less than 2 centimetres would not be clinically relevant, but greater than that could be of some importance. We will now move on to look at the surface anatomy and ultrasound of the femoral triangle. The femoral triangle is not a prominent feature in most people. Its lateral border, the sartorius, and its medial border, the adductor longus, can stand out, especially if the patient was cross-legged. Remember, its superior border is formed by the inguinal ligament. The contents of the femoral triangle include the femoral vein, artery, nerve, and lymph nodes. The order in which they lie can be remembered with the acronym VAN, V-A-N, and that's from medial to lateral. The femoral artery can be palpated by finding the asis and the pubic symphysis, and going to the mid-inguinal point and just inferior. By using the width of my palm, I can isolate the femoral artery. Approximately a finger's breadth either side of this pulse will lie the femoral nerve and vein. The femoral artery is superficial for about 5 centimetres before it dips under the sartorius and passes into the adductor canal. With the ultrasound probe in the transverse plane, we can identify the femoral artery and femoral vein. As we've discussed, we would expect the vein, artery and nerve to go from medial to lateral. However, in this patient we can see that the femoral vein is just inferior to the femoral artery. The femoral artery can be seen pulsating, and if we place slightly more pressure, we can see the femoral vein compress. Just lateral to the femoral artery, we should be able to make out the femoral nerve. If we place the transducer on the anterior surface of the thigh on the distal 1/3, we can identify the different muscles that make up the anterior compartment. Deepest on the screen we can see the outline of the femur as a bright white semicircle. Immediately above this we have the vastus intermedius, and then above that we can see the outline, the oval shape of the rectus femoris. If I move the probe more medially, we see the bulk of the vastus medialis come into view, and if I move it more laterally, we see the bulk of the vastus lateralis come into view. If I place my ultrasound probe on the anteromedial surface of the thigh, approximately 1/3 from the pubis to the knee, we can look at the adductor canal. Again, here we can see the femoral artery, which is pulsatile, and the femoral vein, which is shown as compressible. You can also see the roof of the adductor canal, which is the sartorius. And on the lateral side, we have the vastus medialis muscle. And on the medial side, it's made up of the adductor longus muscle. In this video, we looked at surface anatomy and ultrasound of the femoral triangle and the anterior and medial thigh. Thank you for watching.